Welcome back. In this show, you are watching what we found out when we visited various counties, various hospitals, to find out the impact of devolution of health services. From Baringo to Bomet, from Bungoma to Marsabit, Tana River to Nyeri, to name a few. This is the Chamwada report. We begin with Vihiga County in this second leg of the show, a county in Western Kenya with a population of about 550,000 people, according to the 2009 national census, one of the most densely populated counties in the country. At the county's referral hospital, based at Mbale town, we found works going on in readiness for the installation of specialized equipment under the national government support program that is known as the Managed Equipment Scheme.
We have a state-of-the-art machine that we had bought as a county government. At the same time, the new X-ray machines, which is an extensive X-ray machine. So when you look at in that diagnostic areas, we've improved a great deal as far as the county government is concerned.
In Vihiga County, there are about 640 health workers on the payroll.
At the time of devolution, the national government had not handed over the payroll to the county government. So it was very hard for us to adjust the payroll to the county government. There were so many challenges whereby you'll find somebody is working in Vihiga County but is earning on the payroll of Kakamega County. Somebody is working in Kakamega County or Kisumu County, but he's earning on the payroll of Vihiga County. So we had so many hitches here and there. But at the moment, we've worked together as a team with other counties to make sure that we clean up the payroll. As far as we are concerned in Vihiga County, the payroll is up to date.
We have just started a radiology department which has never been there before. What we are still lacking is maybe a radiographer. The machines are already installed. This one is going to help retain our patients that require such services within, not for referrals.
Still in Vihiga, like in other counties, there are mixed views about the quality of health services.
I'm a resident here at Vihiga County, but services at Mbale County Referral Hospital bado ziko chini. Because most of the time, mtu anakuwa referred ende referral, ama ende ni Nyanza, Kisumu, napata madawa saa zingine haziko.
Kitambo tulikuwa tunakuja hapa tunakaa, unaweza kaa karibu kwa masaa mawili matatu hivi kama umekaa kama uhudumiwi. Labda ukienda kuhudumiwa wanakuambia enda nunua madawa, na kwa saizi ukikuja ukihudumiwa unapata madawa iko.
The services have been taken closer to the wananchi. The most and maybe the biggest challenge is the delivery of the services. We have the facilities, but they are not well equipped.
The only challenge that we have at the county at the moment is inadequate funding to the health sector. If there is improved funding to the county government from the national treasury, and then the county would give the health department a larger percentage of the county budget, then we shall be home and dry. In the last financial year, 20% of the county budget went to health. But when you look at that 20% of the county budget, 80% of that departmental budget, health department, goes to salaries.
From Vihiga, we cross borders to Kajiado County.
Actually, for us in Kajiado, devolution is a blessing. The devolved functions have really brought a change in the lives of wananchi. When we came in as a government, we had issues of access to healthcare. The facilities that were constructed 20, 30 years ago are the only facilities still operating despite an increase in the population. And we'd have women and children and men even walking very long distances in very difficult terrain to access healthcare. For now, up to almost 72 facilities are being renovated. We have new ones, like now we are speaking about maybe almost 30 coming up.
This is a new dispensary in Kajiado East. For locals, distance to a health facility has been reduced.
Kutoka matibabu ya kuje ni mazuri juu watu walikuwa wanateseka sana. Mtu alikuwa anaweza akagonjeka na kupelekwa hospitali ilikuwa mbali sana. Kwa hivyo sasa ni nzuri juu mtu akigonjeka saa hii
usiku anaweza akapelekwa tu direct, hapa ni karibu, na matibabu yake ni nzuri, dawa ziko, kila kitu ziko.
The way we approach our development in Kajiado, it's people driven. We do not sit as an executive and say we are putting up a hospital here. Citizen participation in every ward in the counties.
In Kitengela, this sub-county hospital is undergoing improvements to step up specialized treatment to reduce pressure on the county's referral hospital, according to the CEC in charge of health.
We have our main hospital. It's not yet a level 5 because from devolution we did not have any level 5. So it was a level 4. Now with everything we are doing in it, we hope that it will go to level 5 where it's able to actually offer everything. Then we have a hospital like this one, which is a level 4. There are 2 of them. And then we have the health centers, which are level 3. And then we have now the dispensaries.
Madaktari wanakaa na hata manasesi ni wachache, kazi ni nyingi. Na upande wa mahala hapa, ningeomba kama wanaweza kusaidia upande wa neti, mashiti tunaona ikiwa chache, lakini upande wa matibabu iko sawa zaidi.
In Kisumu County, whose population was about 969,000 in 2009, there were about 69 doctors before devolution. Now there are 108 doctors.
We've been able to create a strong dialogue system with our health workers, especially with their unions. First of all, we cleaned up our payroll so that we know exactly who are ours. And then we were able to now make sure that one of the issues that was of concern to them was their promotions. That is something that we have managed now to settle with them. We also settled their salaries, making sure that their salaries were coming on time. And with the county government, at least we've been able to make sure that at no time have they missed their salaries.
Kisumu receives many referrals from neighboring counties due to what officials here say are better specialized services at the county's referral hospital as compared to what is found in some of the neighboring counties.
Tunaomba kaunti ya Vihiga tusaidie tupunguze mwendo. Ingawa hapa ni pazuri sana.
3 years ago we'll struggle to do about 15 operations. We go to 25 now on a heavy day, but on the average we are on 18 patients, a minimum of 18 to 20 patients in a day. But we go 25 patients, so that you see the increase has been about 7 more cases done in a day. Megascope was the supplier. I think they supplied, renovated this theater, and they supplied, as you can see, we're starting from the machine, the Mindray machine, the monitors that have come with it. This bed has been brought by Mindray, and the operating lines, aircon, so, and the renovation.
Sasa hii naona mabadiliko ziko, at least dawa zinaweza patikana. Ni vile mashini sasa zingine naambiwa zimeharibika. Kama ya x-ray niliambiwa imeharibika this week on Wednesday. Kaambiwa niende nifanye x-ray nje.
The Doctors Union maintains that only a legal framework that will harmonize the management of health workers in the country will provide the solution.
Nearly all healthcare workers were employed by the Public Service Commission. They signed employment contracts with the Public Service Commission. And then devolution came. These workers were not given any new terms. They were not handed over. They were not told, now your employer has changed. They didn't sign any new papers. The county does not know when they employed you. They were never given files then in terms of when was this worker employed, who trained this worker, what are the qualifications of this worker, when are they due for the next promotion, which trainings should we expose this worker to, what work can this worker handle. So that was never done. And that is why there has been a lot of problems in the last 3 years. Because healthcare workers want promotions. Counties did not have those files until August of last year. And even right now that counties have those files, they do not have the competence to interpret those files.
It is expected that the health bill that is already in Parliament will lead to better management of the health sector.
We are looking at a bill which will give us the framework to be able to provide an harmonized way, the way we govern the health sector in the country. We are looking at that bill to be able to help us to interpret the content of the Constitution, the intent of the Constitution, to bring it into the law so that we can now begin to operationalize that. Without that bill, we are in an environment where we are doing things differently, but we are using the old laws which existed.
On that note, we come to the end of the show, but not the end of the discussion. We will continue with the topic, health in devolution, next week. We have more from other counties.
Before devolution, they used to receive drugs worth 100 million only. After devolution, we purchase drugs worth about 450 million per year. So we pay KEMSA on quarterly basis.
The volumes that the counties are taking from KEMSA under devolution is 40 to 50% more compared to a similar period before the devolved healthcare system.
So make a date with us, same time, same channel. And on behalf of the crew, thank you so much for watching. Bye-bye.